Hi, I am Sandra Nájera and I will be presenting the Licensed Professional Counselor Job Analysis. We're going to start with job summary. In this position, the licensed professional counselor provides individual and group psychotherapy. LPC will be required to do assessments, evaluations, and treatment plans for clients. Also, the clinicians will work in various settings such as mental clinics, health clinics, hospital, and private practice. The use of various therapeutic techniques is critical to address emotional and psychological challenges to the client. Next, we have responsibilities. The first one is client assessments. LPC do client assessments to be able to identify disorder. This is crucial to be able to develop a plan, get feedback to the client, and develop a relationship of trust with the client. They will also have to build rapport, monitor progress, and as I said earlier, provide feedback to the client. This is very important because this is where you or the clinician will tell them the client where they stand, if they have made any improvements based on the treatment plan created for them, or if they need to change the technique to treat their disorder. Document sessions and keep confidentiality, active listening, and reliable attendance and arrival to work on time is required. Manage clients' scheduling and maintain license up to date. The next one is their qualifications. The first one is a master's degree in psychology or related field. 2 years of supervised clinical experience providing counseling services, ability to convey ideas, feedback, and information effectively, whether it's in writing, verbal, or non-verbal. Strong interpersonal communication abilities are essential for productive client interactions. This means that you need to be good with people, whether it's communicating um, through verbal or written or nonverbal. They will help you build a better relationship with the client. Ability to evaluate intricate psychological or emotional problems and develop successful treatment strategies. Adherence to ethical guidelines. This is another important factor of being a licensed counselor, because anything that the client shares with the counselor stay between him or her and the client. They cannot be telling anybody else about the client's disorders, or unless is with like a doctor or sometimes court. But other than that, they have to keep that confidential. Organizational skills and attention to detail, time management, and another one that I found very important was knowledge of social issues, problems, and available resources. One of them is diversity. I feel that social issue is diversity, different cultural backgrounds also they have to be aware of. Critical incidents for this position are susceptibility to client's trauma. This means that the LPC needs to be trained and not engaging or not carrying their client's trauma, or blaming themselves for it. So another one is lack of emotional stability. They have to be emotional. They call it emotional intelligence, which will help the LPC kind of manage their feelings when it comes to the clients sharing their experiences, and things like that. Treating someone with different ideals. The other one is the lacking the ability to comprehend diversity. This is a big one, especially here in the United States. So someone better suited for the LPC position will be somebody that has a knowledge of the different cultural backgrounds here in the US. And the last one is practitioner perspectives. The first one is natural helper. The other one is sensitive, empathetic, and being empathetic is crucial for this position because people come to their counselors with a lot of trauma and issues and problems that they otherwise will not share with anybody. So being empathetic, good listeners, and good judgment will also help them succeed in this position. And the last page is about the references I use for this. And I hope you all enjoy this. Thank you.